Welcome to the MedSynapse podcast, where we connect with leading medical professionals to discuss the latest innovations and trends shaping healthcare. Today, we are excited to have Dr. Veenesh Selvaratnam, a renowned consultant orthopedic and hip and knee surgeon with us. Dr. Veenesh is at the forefront of robotic hip and knee joint replacement surgery, practicing at the University of Malaya Specialist Centre and University Malaya Medical Centre in Kuala Lumpur. His work in advancing same-day discharge after total knee replacements is truly groundbreaking. Total knee replacements are among the most successful surgeries worldwide, with millions benefiting from restored mobility. But imagine the convenience of having this life-changing surgery and returning home the same day. Or this is exactly what Dr. Veenesh Selvaratnam is pioneering with daycare same-day discharge protocols. Dr. Veenesh, could you start by explaining the concept and benefits of daycare same-day?
So essentially, the concept is the patient. What we normally do is that this patient we choose a suitable patient, and what exactly happens is patients they come into hospital at about 7:30 in the morning of their surgery. Then before the surgery itself, they're seen by the anesthetist, and because we see the patients as well, just to make sure that they're fit for daycare surgery. I'll tell you later on about how we select these patients, but the concept is essentially patients come in. They come in the morning. They have their surgery. The surgery starts about 9 o'clock in the morning, and it's completed by about 10 something. And the patients are actually taken to the recovery in the daycare unit itself, and 6 hours post spinal anesthetic. So roughly about 3 o'clock in the afternoon, patients are mobilizing full weight bearing with the aid of a walking frame under the guidance of a physiotherapist. So we get them walking, and once they're deemed to be fit, we discharge them at about 5 o'clock in late afternoon, essentially. And essentially is what we say is office hours surgery. And it's basically revolutionized our knee replacements here. I mean, this is a concept that I brought in actually from the UK, because I was working in the UK for about 18 years, and I returned to Malaysia about 4 years ago. And I think the benefit is, I think we initially brought this concept to our university hospital in Malaysia, is because our waiting time is slightly prolonged because of previous COVID. So we got a long waiting time. We've got a lot of patients on our waiting list as well. And what we were trying to do is to try and reduce the waiting time for patients undergoing knee replacement. And obviously, not all patients are suitable for this procedure. So we choose the ones which are fitter, who do not have any too much deformity in their limb or in their knee, and patients who live nearby. They got good family support, and patients are willing. I mean, some patients do not like to stay in hospital, and so these are the ideal patients for daycare total knee replacement. And it's something we started actually in March 2023, and more patients are accepting it, especially in countries like Malaysia, where I mean, we don't normally do many of this daycare, and this is something new. So patients will need to accept it first, and the family members need to accept it, because when you tell them about daycare, they say, "Oh, can be done at a daycare? Can the patients go home? Can I walk the same day?" But I mean, with good, I mean, with new technological support, and the way we do it, the way we do our knee replacements, and good anesthesia, maybe we can do it here because we've got a good team. We've got a good anesthetic team. We have got a good team in our joint reconstruction unit as well. We've got good theatre staff. We've got good hospital management who are supportive as well. So with a multidisciplinary team, we're able to do it in University Malaya Medical Centre.
That's incredibly insightful. It's remarkable how this approach not only speeds up recovery, but also significantly enhances the patient's experience. Your efforts are clearly setting new standards in orthopedic care.
Thank you.
Since you mentioned that not all patients are candidates for same-day discharge, What specific criteria do you use to determine this eligibility?
So I think first of all, the patients, they need to be either ASA 1 or 2. So patients who do not have any significant medical problems like any heart problems or lung problems. Patients who are seen by the anesthetics, they need to be fit as well. So I think there are a few things really. So one is essentially patients itself, so how fit they are, just to make sure that no reason significant medical problems like previous strokes or heart problems or ischemic heart disease, I mean any heart significant arterial disease of their heart. So patient factors again, whether the patients they live nearby. So we want patients who obviously stay within the city itself, somewhere around our vicinity of a hospital, not from patients from outstations or out of the state. So they need to have good family support as well. So patients are not too big, so their body mass index is not too significant, and patients who do not have too much deformity of their knee, so they have got like standard knee osteoarthritis, obviously end stage osteoarthritis, but with not too much deformity. If you do too much work on the knee, so you do too much releases and things, they get more swelling, more pain. So I think those patients are not very suitable. So the more standard knees are the ones that we look at, and patients are willing to participate as well. So patients who say, doctor, I don't like to stay in hospital, I want to go home the same day, I don't like to stay too long in hospital. So those are the ideal patients, and they have good family support. So they need to go home to someone who lives with them, because I mean you never know, they may get some problems and they may need to come back to hospital, or if they go home on the same day. I mean, knee replacement is a big enough surgery, and you need someone to look after them as well. So you need so these are the main things. And in regards to the surgeons as well, so you need to have someone who has got experience in doing daycare knee replacement, because the way we do it here is a bit different as well. So we don't use a tourniquet. And with regards to the anesthetics as well, so we give a spinal anesthetic, and we give an adductor canal block, and we give local infiltration, and we make sure the patients are optimized with regards to their analgesia as well. So how we choose is that we go through all these criteria. We speak to patients and see whether they're willing to participate in daycare, only suitable ones really, and those who are not above the age of 75, because I think those patients are too risky. And once we think as surgeons, we orthopedic surgeons in our unit here in the Joint Reconstruction Unit, University Malaya, once we think that these patients are suitable for a daycare surgery, then they are sent to the anesthetist, because the anesthetist needs to be comfortable as well, because they will see whether these patients, whether they may develop any complications when they go home, whether they're suitable for same-day discharge after a major surgery. And once we, the orthopedic surgeons and the anesthetists, are happy, as well as the patients, obviously, they undergo routine investigations such as routine blood tests, ECG, chest x-ray if indicated, and if everything is fine, then these patients are listed for a daycare knee replacement. And now our daycare knee replacements is quite special as well, because these patients are not admitted to the ward even for a single second. So the whole procedure occurs in the daycare theatre unit. So patients, when they come into hospital, they don't go into a ward, but they walk in straight to the daycare admission area. And via the daycare unit, they're basically sent to the preoperative bay. Then the surgeons, we see them again. Then the anesthetist sees them again. And from there, they go to the daycare unit. They have their surgery done. And then once the surgery is done, even in recovery is done in the daycare unit itself. And the patients are mobilized from the daycare unit as well. So during the recovery bay, the physiotherapist sees them, and we get them walking in the theatre recovery bay, and they go home from the daycare unit as well. So the whole process occurs in the daycare unit. So patients do not even experience the wards here. So that's quite it's good really for patients, for us, and for the hospital as well.
It's really fascinating to know all of this, because it's like a normal routine procedure then. whatever you are doing, it's happening in the daycare itself. So the patient also feels confident about it. Yes, that I can get it done in a day or two. So they might be sharing it with other people who are experiencing such issues, and if they want to get the knee replacement done, and if it is done in a day, then definitely it's actually changing the whole scenario or the aspect of knee replacement. So,
That's true.
yes. So, moving ahead with this, robotic assisted surgery has revolutionized many aspects of healthcare. How has it specialized? How has it specially improved the feasibility and outcomes of same-day discharge for total knee replacements?
So initially, when we started our daycare services here in University Malaya Medical Centre, we started it using conventional methods without the robot, and even then patients were being discharged and they were doing well for daycare as well. So we didn't start off by using the robot. Our daycare started off by doing the conventional method. So I think and so this was in March 2023, and we only got the robot in August 2023, and then now most of our daycare knee replacements are done robotic assisted, but not all of them. Some patients say they get a bit scared hearing the word robot. They think the robot is doing the whole surgery for them. Some people say, "Oh no, I don't want the robot. I want you to do it." But with the robot as well, it's basically it's planning and we surgeons do the surgery. So with regards to the robot, I mean, the perceived benefit is patients get early recovery. You don't do too much soft tissue release, so they don't get too much pain. So I think that there are benefits of using the robot, because it helps you with planning. It helps you to say what implant sizes are needed, just in case sometimes you get surprised, because sometimes the patient has got a very big knee, so you need to make sure that the implant reps brings in the correct sizes of the implants, and sometimes they're very small, so you need to bring the correct sizes of the implants. So I think but also the word robot, some patients like it, some patients do not like it. I think most patients like it, to be honest with you. And so I think it helps with planning, and it maybe does help with a bit of alignment, of cutting cutting your bone, and where do you cut it. So it does help us, but as I said, it depends on, I mean, it's daycare, it's multifactorial really. So I think the way you do it, and I don't use a tourniquet, as I said earlier on, so you need to make sure you get good soft tissue closure. So you need to make sure the patient obviously doesn't bleed, because if you get a bleeding wound or a oozing wound, then the patient can't go home. So you need to make sure that your soft tissue handling is good, your soft tissue closure is good. You need to get essentially airtight skin closure as well, because you do not want the patient to go home and ooze, and then the patient will need to come back to hospital. So we have not had any of these problems. But with regards to the robot itself, so I think it does help to a certain extent with regards to planning and things, and with regards to the outcome as such, personally I think using the conventional method and using the robotic method, I don't think there's significant difference, but it does help with planning. And maybe I can't definitely say whether patients get less pain when you use the robot. I think it's more than the robot. I think it's patient factor, surgeon factor, how patients are, how well they've got their pain threshold, and what kind of painkillers you give them. So I think it's multifactorial. So I think the robot just helps with more with regards to planning the surgery, and maybe a bit with less soft tissue releases. But with regards to daycare, I don't think it's that it's revolutionized that much, because I was initially, when I started off, I was using the conventional method as well. But it's nice to use the robot, because it's something new, so everyone likes new things, and I'm robotic trained as well, so I think it's a good system to have. It's nothing bad about the robot, so it's good.
fascinating to see how technology is driving such meaningful improvements in patient care. And your use of robotics is a prime example of that, because you are combining it. You are combining it with the conventional techniques and you are using it for planning only. So it is again a fascinating thing for me to know about it. And moving on to the next topic, that is effective pain management. As you mentioned pain, and you mentioned that there should be some conservative approach so that the bleeding and bruising does not happen and the patient does not stay in pain. Otherwise, the patient cannot be discharged the same day. So, what strategies do you find most effective for ensuring patients are comfortable after surgery?
So I think it starts off before surgery itself. So patients, they need to essentially get some physio. They need to try and increase the range of movement with some physiotherapy. They need to work on their muscle strength. So we send them for some physiotherapy just to make sure they get their muscle strength is good. And I think the most important thing is during the surgery itself. So I think so all our patients have undergone spinal anesthetic. So they have a spinal anesthetic. So rather than a general anesthetic, because I think general anesthetic they will get more side effects, like they'll feel a bit drowsy, they'll feel a bit nauseous, vomiting. So all this can be reduced if you give a spinal anesthetic, and then we supplement it by giving something called an adductor canal block. So basically it's like a regional block in the leg as well, just to numb some of the sensory nerves that supplies the knee to help with pain. And we also give these patients local anesthetic infiltration into the knee. So it's called periarticular injections, local anesthetic injections into the knee as well while we're doing the surgical procedure. And obviously the anesthetists, they will give their cocktail of medication as well, some opioids and IV paracetamol. But after surgery, I give all my patients essentially paracetamol, Celebrex, which is a non-steroidal anti-inflammatory drug, and tramadol, which is an analgesia. And the thing is that I find most of these patients, you shouldn't get them up too fast. So even after 6 hours, when the spinal wears off, you shouldn't get them up too fast when they're lying for so long. You should just get them sitting up in the bed first of all. You probably should wait for about 10-15 minutes, get them to sit on the side of the bed, again wait for 10-15 minutes, and then only you need to get them walking, really, because they get a bit of dizziness, and they get something called like a bit of postural hypotension, so basically a bit of low blood pressure after the spinal anesthetic. And so this all can be relieved or can be prevented by doing these measures. And I give them some antiemetics, so something to prevent vomiting as well, because they can get side effects from their painkillers as well. So I give them some anti-emetic to prevent them from vomiting. And during the recovery period, while they are in the recovery bay, I give them some fluids as well, IV fluid, just to rehydrate them as well, because obviously they've not had anything since about midnight, really, the previous day. So and before they start walking as well, I just make sure they get some food as well to eat, some at least some biscuits and a cup of hot chocolate as well. That helps boost their glucose level in their body as well. And so these are the things, and you'll be amazed, really. I mean, how these guys do. You know, these patients, they're walking, because some patients are very skeptical before the surgery. They think, oh no, I can't walk. What do I do? I said, okay. They said, are you going to send me home before I start walking? I said, no, you get you walking first. Only then you go home. As long as you're safe, only then we'll send you home, I tell them, you know. But so far, our selection has been perfect, and it's been amazing, really. So we have got a very strict criteria. We don't overdo it, and patients are even flexing their knee up to about 90-100 degrees in the recovery theater before they go home. So I think it's all down to good team effort, really. And so these are the things, really, that we do. And I gave them analgesia or painkillers for about 2 weeks, but I sent them home with antiemetics, so something to stop them from vomiting, and I give them some PPI, so proton pump inhibitor, so that they don't get any refluxes and things as well. And in our hospital, we send patients home with 2 weeks of aspirin to prevent any clots as well. So we give them 100 milligrams once a day of aspirin, which we have been doing for years, and these patients have been fine.
So managing pain while optimizing recovery is crucial, and it's clear that your protocols are designed with patients' well-being at the forefront. With patients heading home the same day, how do you ensure they are properly monitored and that potential compliance or complications are managed?
So, as I said earlier on, our selection criteria is very good. So we make sure that every patient who has agreed, or patients who have been listed for this daycare, they have got someone at home with them, and they don't live too far away from hospital. And we are quite lenient with giving out our phone numbers to patients as well if they need any help. So patients feel a bit comfortable with that. When they go home, they know if they got any problems, they can give us a call, really. So I think if you give patients your numbers, they don't really call you unless they really need to give you a call. So with regards to compliance and complications, so I think preoperatively, we counsel our patients very well. We tell them, look, the few things that when you go home, you need someone close to you. If you've got any complications or you feel unwell, you can come back. You can come back via to the emergency department or give us a call. We'll be happy to help you. And I think that the most important problem or the most common things that patients complain is they get a bit of dizziness and they feel sick. I think most of the time maybe it's due to side effects of their opioid. So these days, as I said, we have started giving them patients regular medications to prevent vomiting as well. And with regards to complications, I mean, none of our patients had any major complications that needed to come back to hospital. And I mean, so far our patients have been, they've never had any wound problems. So patients didn't have any leaky wounds when they went home. And we see our patients about 2 days after they go home. So if we do them on a Wednesday, they come back to our clinic and see us on a Friday just to make sure everything is fine, just for them to have some safety net as well. They feel happier seeing the doctors early on. So we tell them, look, when we send you home after the daycare, doesn't mean we're never going to see you again. So when they see us, and we tell them, look, we're going to see you back in 2 days, they're happier that way because they like some kind of reassurance. And so these are our safety things, really. So I think giving patients your number is fine, and seeing them quite early on and reassuring them and making sure they're safe to go home before you send them home. So to be honest with you, whenever I do my daycare, I'm there when patients are walking. I'm there before the patients go home as well. So I think this patients love that, especially when they think that you're trying to do your best for them. So I think gives them some kind of reassurance. And these are the things that I think sometimes is more psychological than sometimes you need to treat the patients itself, So I think these are the things that we do here in our center that helps with improving patients' outcome and also making our daycare services a success.
It's reassuring to hear that even after discharge, patients receive such diligent follow-up care. This speaks volume about your dedication to their long-term recovery.
Thank you.
Finally, how do patient outcomes and satisfaction rates with same-day discharge compare to traditional inpatient approaches?
So I think that's very subjective, because what I find is that patients who go home the same day and patients who stay in the same day, they get the same painkillers, they get the same kind of intervention. So patients, when they stay in hospital, they get the same painkillers. When they go home, they get the same painkillers as well. So the good thing is, I mean, this is something that patients, or I don't know, maybe it's different culturally. So some patients, maybe in this part of the world, they're a bit scared to go home. They think it's safer to stay in hospital. But in hospital as well, I mean, it's not the best place to be in, especially when when you're quite elderly as well, because you can get infections and things. So I don't think there's much outcome differences between patients who have inpatient knee replacement and patients who have a same day discharge. But in our center, at least about 3 patients have come in who have got both knees, arthritis in both the knees. They have had one knee as a daycare, and they've come in after about 3 or 4 months for the other knee as a daycare as well. So they are happy with daycare. But I think once this is built into patients' mind, once they're reassured, and I think this will change the practices for same day daycare, same day discharges, knee replacement. So I don't think there's much of a difference with regards to the outcomes, but and maybe patients, they go home, they sleep in their own bed, they have home cooked food. Maybe that's better for them rather than staying in hospital.
Definitely. So it is like you are actually pointing towards an holistic approach, and at the same time you are looking towards an approach wherein the patient is most comfortable. Because if the patient feels homely and he feels that I can get it done in a day or two, as you mentioned, it's more psychological. So here it is, the patient outcome automatically increases and it becomes better.
Yes, it does.
So before we conclude this session, I would really want to hear your thoughts on the MedSynapse platform, and how has your experience been, and how do you see the medical professionals getting benefit from this?
So the thing is that I think MedSynapse is quite good, because I think a few of my colleagues have been on it as well, and I think it does disseminate information quite rapidly, especially with everything is on the media these days and on social media. So I think this will definitely help the medical profession. Not only the medical profession, I think also for patient care as well. So it's the general population, not only the medical profession, but I think the general population as well. So I think it's definitely a good thing, and it's good to disseminate information to people around the world, actually.
Thank you so much. Dr. Veenesh, it has been a pleasure to have you on our podcast, and thank you so much for sharing your invaluable insights with us today. Your pioneering work with orthopedics is truly inspiring, and I'm sure our listeners have gained a lot from this discussion.
Thank you for your time. It's great being here, and I hope I've given you guys some good information, and hope to work with you guys soon again.
Definitely. We are looking forward to such more podcasts with you as well.
Thank you. Thank you for your time.
Thank you. So, to our listeners, we hope you found today's episode as enlightening as we did. We encourage you to join the conversation and share your own insights on MedSynapse. Together, we can continue advancing the field of medicine and improving patient care globally. Until next time, stay connected and keep learning with MedSynapse. Thank you for tuning in today.